I'm Mark Heyward Johnson. I've been a nurse for January will be 27 years. In those 27 years, have about half of that time patient care at the bedside. The other half I've spent working in health IT, health nursing informatics. My experience on the nursing side is typically med surg tele, oncology. I've done some psychiatric work in large psych hospitals on the West Coast. I've done some orthopedic rehab. So I've got a good sampling across the board from adult perspective, from a nursing care history. In the nursing informatics side, I've been board certified in nursing informatics from the American Nursing Credentialing Council since 2005. So next year is 20 years somehow I've been certified in nursing informatics. I'm also board certified in med-surg nursing from the Academy of Med-surg Nursing. Next year in 2025, I will be the national president of the American Nursing Informatics Association. And I work for Prisma Health here in South Carolina, which is the largest healthcare provider and hospital network in South Carolina. And we also have recently expanded into Tennessee, partnering with a hospital there. So a regional healthcare system that is rapidly growing. And I do some informatics work for Prisma Health as well. I live near Greenville, South Carolina, and just enjoy living where I live. We were spared some of the wrath of the hurricane that Western North Carolina got, but we did get a big, powerful punch, and a lot of people lost power and everything for at least 10 days or so down here, but nothing like Western North Carolina to give you a perspective of where we are. I do live for live music. That's the truth. I have no idea how many live concerts I've been to. I've seen some artists over 100 times. I've seen a lot of bands over the years, and I think this month I was talking to a friend earlier today, and I was like, "Yeah, my calendar's a little weak this month," and it was a joke because I think I have like 7 concerts already. I'm flying to Florida to see a band, and it's just there's a lot going on. But I do live to go see live music. There's no doubt about it. So the power of music in my life is something that I don't take for granted. It's something that it's a matter of quality over quantity for me. I go see some of the same artists repeatedly just because I know what I'm going to get when I go there. It's, you can compare it to a worship service, or there's a definite spiritual content there for me. I'm fed from that. It's a reciprocation but from the artist and the audience. And if you go see some of these artists over and over, you get to know them and you get to hang out and, chat with them. That's always a plus as well when they see you and you get a chance to speak with them. So, yeah, I absolutely love good music, and I love live music, and what happens is so electric. It's so transformative, and it feeds my soul. It really does. When I first found out about the partnership, and that was one of my goals in my job there was partnerships and strategic partnerships at that company. And when I found about Coro Health, I was as most excited I've been on that job. I can tell you that much. I was like, these are my people. These people know what I'm talking about. And to see it organized and have a platform and how we could plug into that and at the fingertips of those patients in the hospital to cue music up on an iPad or a pillow speaker or whatever it might be, that was so exciting to me and made so much sense because I'm of the generation where we didn't have 18,000 songs in our pocket all the time, but I very much appreciate that now. I have a 1 terabyte iPhone and half of it is filled with songs, even though I've got a library that's massive and, I can stream whatever, but I like to have them downloaded and ready, even if I'm not on good Wi-Fi. But to have that platform there for the patient, it's more than just, oh, this cable service in my room here at the hospital has 33 music channels, and they're just based on genres, and it's sort of a roll the dice. What are you going to get for a song? Where Coro was able to, make those playlists and be very specific about what is in the intent of this playlist? Is it to calm my anxiety, to get me focused, to elevate my spirits, or to have a worship experience? Whatever it is, they put those playlists together, and it felt more with intentionality and focus around that power of music versus, okay, here's 30 channels. And that was very exciting to me, is how patients would have that potential to access that power of music right there on their pillow speaker or the iPad, whatever was that particular customer was using to tap into that MusicFirst platform. I've kept up with Coro Health. I've seen they've got the mobile apps so that you can have that in your pocket if you're not there on where you have access to the more traditional platforms where they've been able to stage that music. You can plug into a Bluetooth speaker, connect, however you need to, or just play off those speakers on that portable device. And I do that all the time. I've got an iPhone in my pocket just for secure messages to providers, that type of thing, but it's got my library on there, and I'm not afraid to pull that phone out and play music with my patients. Just the other day, I had a patient that was transitioning into end of life hospice care, and she'd been with us for almost a month, and somehow we started talking about Leonard Cohen, and I'm like, oh, I love Leonard Cohen. Have you ever heard this song? And it was Bird on a Wire. And she said, oh, that's one of my favorite Leonard Cohen songs. I said, have you ever heard the Tedeschi Trucks Band do it? She's like, no. So I queued it up right there, and neither one of us spoke for the entire song. And when it was finished, she had tears in her eyes. She said, that's one of the most beautiful things I've ever heard. If I didn't have access to that library, I would have been like, oh, yeah, love Leonard Cohen, love that song. That only goes so far. But when those notes and those waveforms start coming out of those speakers and connecting with you, it changes you. It changes the energy in the room. It lowered her blood pressure. She opened up. She was so afraid of what was next for her on this journey. But to give her that moment of, it's going to be all right, no matter what happens, it's going to be all right. And that was a very emotional interaction. I think I'm always looking for an opportunity to have those discussions because it is my passion. So you're like a pollinator. You're going from one patient. I'm not in an intensive care unit where it's one-on-one or 1 to 2 patients. It's typically 4 or 5 patients. And many times I'm charged. So I'm dealing with 26 patients, and I have to go in as the charge nurse and talk to them and meet the family and all of those things. So it's like speed dating. You're just going from one person to the next, and you're always looking for, how can I build that relationship? And I've found in my experiences, when we can connect over a song or an artist or something like that, that's so much deeper on a spiritual level and on a personal level than, yeah, I like this football team and this and this. And then when you can bring that into the conversation or bring that into the setting, whether it's a senior citizen who's got dementia and they're delirious from being in the hospital, and daughter says they love these songs, and you just play some old Bing Crosby or whatever it might be, and then they know the songs, they start singing, they stop worrying about, oh, I'm in pain or I'm scared, and they just start singing the song, and it just changes them. Their brainwaves switch over. So I'm constantly looking for those opportunities to build those relationships. So I would absolutely say, yeah, I would agree. It's something that first and foremost, as I'm doing those rapid fire relationship builds, how can I connect with this person? And I've had patients come back and say, oh yeah, you're the guy that went to that concert, and I would just went and saw this person, and I was hoping you were going to be here so I could tell you I went to this concert and this is what happened. And that was recently that happened. It's like, he's like, were you at that show? I was like, as a matter of fact, my son and I were there, and and it was just like, and we just started talking about it. And I had just walked into the room, and he had been waiting for me. He had a readmission, had to come back, but he's like, yeah, I remember we talked about, this band and that band, and so yeah, it's always something as I'm looking to put someone at ease, build that relationship, let them know they're a person, I'm a person, we're going to work together as a team. How can we have a bond? And if it's a bond over music, then, we can make that happen. I don't care what music it is. It can be anything. I'm going to, if I've got an opportunity to join them in that joy, we're going to do it. So I don't typically go see a band that plays the same set list over and over. If I do, there's maybe it's the last tour or something like that. Like I would go see Rush every tour I could. And I took my sons to see them a couple of times, my older son especially, and they would sometimes play some of the same set lists over and over with a few songs here and there changed just for they knew there's somebody out there that saw this last night and we're going to make it a little bit different, a little bit special for them. So yeah, and I don't know how many bands I've seen locally. There's a music festival that I do all the archiving at the soundboard for. For 15 years, I've been involved with this festival. It's called the Albino Skunk Music Festival. It's bluegrass, and it's since morphed into just straight Americana. So Billy Strings has been there 6 times, War and Treaty, Lake Street Dive. So many bands that you hear on Sirius XM or Americana radio. They love this little farm that's 3 miles from my house. And right now, I'm working with a group. We're doing a benefit album for Western North Carolina of all the songs that have been played over the last couple of years by North Carolina artists at our festival and some other artists that love North Carolina. So we're going to be doing a Bandcamp benefit album live at the Albino Skunk Music Festival. And all those recordings are ones that I've pulled together and worked with a guy, and we're prettying them up as best we can. They sound great, as they are, but making them shine, and looking forward to getting that out before Christmas. So that's something I'm doing on my part-time to help our friends in Western North Carolina have been so devastated. And again, that's where music comes in, builds community to get past this incredible devastation that we saw and that affected the community. And those songs are very powerful, and they sing about North Carolina. They sing about rivers flooding and all of those things, because from a human perspective, those are milestones for generations. We're going to, people talked about the flood of 1916 forever in Asheville. Now they're going to talk about 2024 forever. Until we're gone. That's going to be something that will stick out as a milestone. And those songs capture that from a community standpoint. They mark that grieving. They also mark that renewal and revival that comes after it. And we look back and go, how incredibly devastating that was, and the resilience that we have to still be here. And we sing about it. And it helps us not forget the people that we lost, but it also helps us think about how far we've come since that devastation and how we just had to start over again. And that's something you do in your spirit, whatever your religion might be, but that's more of on a communal basis. And that's where those songs come into that, is we all sing those songs because we'll never forget about that. So I'm just super excited about that too. I've been to Africa 4 times on mission trips. I've been to Haiti on a mission trip, Ecuador on a mission trip. The highlight of every one of those trips was a worship service or a song, the communal experience of worshiping and song with those people. I took an audio recorder because that's what I do. And I took a recording, and some of the church services, and I don't understand Swahili all that well. I practiced for years on just to say my name. Or in Haiti, with this broken down church with a hole in the roof and a drum set that doesn't work, but the guys up there giving it his all, and they are on fire. And it's just like, those are the highlights of all those trips, because no matter where you are, music is a universal language. Universal language. And my own experience, anecdotally and otherwise, where I can see, you have outward symptoms and signs of anxiety. You don't have to be a trained healthcare worker to see what anxiety looks like. What anxiety looks like. And when you can see that de-escalate and see those signs of anxiety decreasing, after you play a song that they remember from their childhood, or some Stevie Wonder song that's their favorite song, or whatever the case may be, you can see those changes, whether it's in their affect on their face, how tense they were in their body. Even vital signs can change. Their pulse goes down, their blood pressure relaxes some. So we can measure it if you're looking for it. It's easy to measure, before and after. For me, that's it. That's the science. That's the science I believe in. That's the science I've seen. You don't have to prove it to me, because I know I've seen it with my own eyes. Music therapy is a key component of, from acute care perspective, because as I work in the geriatric adult population, sometimes patients come in delirious, have altered mental status. I think being able to connect with them on a level that you just can't with some of those basic interviews, when you're trying to de-escalate, I think there's absolutely a place for music therapy. As we've talked about with the example, I think when you're making transitions into end of life care, or there's a diagnosis that came out of the blue for someone, there's always an opportunity in the acute care world to have music help de-escalate, help comfort, encourage, lift the spirits. And I'm a proponent of, it's more than just those music channels. You've got to go a step further. You got to curate it. We shouldn't be on a roll of the dice of, is this a song that's going to connect? We need to have several songs available, and that patient-centered design is, okay, what's some of your favorite artists? When I go to the dentist, even the dentist understands this. They give me headphones if I've got to have a crown or something like that, and they're like, what do you want to hear? Or you can bring your own music, and they'll put the headphones on me while they're, doing the work in my mouth. They understand how that helps me focus, breathe, get through this experience that no one enjoys, of someone drilling on your tooth, to get through that experience. And that's just one example, where in healthcare and acute settings, the power of music is, I mean, we haven't even begun to tap it. If you were to ask me, that's my opinion, is we've got a long ways to go in our patient-centered design of, one, how do I curate this playlist for this patient? How do I know what music would be helpful for them? Because you certainly, there's music I don't like. So you wouldn't want to play that music for me. My wife, she's got a much more narrow set of music that she appreciates than I do. I have a pretty wide palette. So you wouldn't want to play some music that's going to increase her blood pressure, make her feel anxious. So how do we, as a patient-centered design, know what the curation is right for that patient, and then make it available, whether it's available in the pre-op area, available in PACU if you're doing surgical, or anywhere in that acute care patient experience. Because if you've been in acute care lately, you know how chaotic it is. You know how rapid fire it is. You know how you go in, you do tests, you do this, and you may go home that afternoon, or you may stay for 3 days, and it's all dependent on one lab test or one diagnosis, and it's someone's opinion, and there's multiple people with that same opinion, and then someone else has a different opinion. There's a lot of chaos, a lot of churn. So if patients can center themselves spiritually with music, whether it's meditation or some scripture focus, music around that type of thing, man, we haven't even begun to tap the power of music on the acute care side. I think we've just scratched the surface on how we can do that. A training perspective for acute care nurses, especially because we're the ones that are there 24 hours a day, we're the ones that have the most contact with those patients. I think we start with just listening for those opportunities. Absolutely encouraged for you to look for a way to bond with your patient over music. And we have this platform, if that's the case, where you can help them tap into that. So, one, you got to start with making it readily available. Not every nurse has the library I carry around in my pocket. So if you can't depend on the nurse to be the conduit there, you've got to have a platform set up. If you've got a platform such as Coro Health, you start with that education of, it's okay. We encourage you to look for those, talk to your patient, talk to the family members. What music do they like? What's their favorite artist? You know, to look for those things so you can say, all right, I'm going to use this at the right opportunity. And that's going to build that trust, build that therapeutic relationship with that patient, build that trust with the family because I'm interested. I want to be invested in their care and their journey. So empower those nurses is what I would say to, and the techs and all of those nurse extenders, the people that are in the room all the time, listen for those clues, and then, hey, we got this platform. You like 1950s jazz? I got you. You like hymns? Mom always listens to hymns. We got you. Listening for those clues and encouraging our staff to say, let's utilize this to its maximum potential because the power is unlimited, really. So I could just go in and I could just pick that genre and you could finesse it a little bit, but then you'd have a playlist curated just for Debbie so that she could get through the day she has with diagnostic testing and not being able to eat because she's having this test done and take her focus off of all those ailments and focus on, okay, what am I going to do to get through this? And this music's going to help me. We've got the tools. We just got to get an organized, got to get it available, and then just tell your staff, embrace this, encourage them, empower them to utilize that. Oh, that's easy because you're never more alone in your life than when you are in that hospital bed. And if there is a way for me to recognize you and build that relationship and to help you recognize who you are, that that alone is such a powerful tool because people are scared, they're alone, and if someone recognizes, hey, we're going to play this song for you, it's when if it's just like you called and you dedicated back in the day, you called and you dedicated a song to your girlfriend and you're riding in the car and she's with you and that DJ says this song is for so and so called in and he says he loves you. You can't replace that experience. One, it became so real and so personal for you. And then the song, you'll always remember that. And that's the same for that patient is, hey, this song's dedicated to you because we care about you. We care enough to know what your favorite song is or who your favorite artist is. And they're like, you know what? These people really do care about me. I may never see them again, but they care about me as a human, as a spiritual being enough to say, we want to make you happy and we want to put you at ease. And that's going to build trust. That's going to help them on their journey, wherever that journey takes them, whatever the outcome is going to be. It's going to help them on that journey because you took the time to get to know them on that level. And that's a deep level, not just what's your date of birth and what's your blood type. It's who's your favorite artist and what's your favorite song. That that's way down on that, and that touches them, and they don't feel so alone. They don't feel like just a number with a hospital gown on. Yeah, I've had some conversations with some of our patient advocates and our patient relations folks about music. One, I made sure when we switched over from an analog to digital, we just switched our entire cable platform through multiple hospitals. And one of the first things I asked is, did you keep the music channels? I said, because I use that all the time with patients. I'm like, what kind of, what, let's listen to music. because they're like, turn that TV off. I'm like, hey, do you want to listen to some music? And they're like, sure. I'm like, well, what do you like? And there's like, 30 channels of just music based on genre, and I'll put it on, and that helps. So I wanted to advocate, say, hey, keep the music channel. And most of the time, there's no difference in that package. I was very happy to see that they did keep all the music channels when we switched from analog to digital. And in fact, they expanded the number of music channels we had available, where there were like 4. Oh, I think the main thing is the provisioning, is being able to have at their fingertips those MusicFirst channels, the spiritual channels, the music channels, because if you don't tee something up, the patients come in, they're overwhelmed. So you got to keep it simple, and you got to make it available. And that was one of the things that I appreciated about, the Centric platform, and then Coro MusicFirst, is we were embedding it. So when I'm asking for a nurse assistant, I'm asking for ice or bathroom assistants, the next tile over is music channels or whatever the case may be. I got it right there in front of me. I can't miss it. It's on, it's available. So the natural curiosity for the patient is to check that out, or that gives the nurse a way to say, hey, look, you've also got some things right over here you can listen to, some meditation, some calming music, whatever the case may be. Is so that was what was so exciting and so powerful, is it's provisioned, it's there, it's readily available. You don't have to find the remote, because it's built into your pillow speaker, it's built into whatever tablet you might be using. So that was real exciting, and I hope that that continues to grow to make more available for more patients. Yeah, I think the more ambient listening devices that we're going to have, certain cue words or trigger words you may hear, anxiety, or based on context in the room, ambient listening with artificial intelligence can start to curate things in the background to do that set and setting based on baby being born. It's more celebratory. Everything's good. If it's a great birth, everything's going. We can turn this on because everybody's dopamine is off the chart right now. Or if it's an end of life care, that ambient listening, so that a nurse doesn't have to go do any entry. The artificial intelligence is picking up on keywords and triggering those queries to say, okay, this is likely an appropriate music, and then having it ambiently played in the room as an option, coming up on, if they're an audio visual, I, however we can embed it. When their TV turns on, just give them the option. Would you rather listen to music? Because I tell you, there's patients, I go from room to room to room, and it's politics, 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 politics. It's manufactured rage that's not therapeutic. It's not help. And anytime I get a chance to encourage them, hey, why don't we just listen to some music? Because this seems like it's upsetting you. Or why don't cue it up first? Would you rather listen to music than watch TV? Patients may say, yeah, play me some music. So the more we can embed it, make it more patient centric, curated to them, curated to their situation, whatever it is, by ambient listening, and then queuing it up in different ways of saying, okay, hey, let's play this music for them. Or even smart speakers on a stretcher. So as I'm going down the hall to go to my MRI, it's playing some relaxing music for me. Might not be specifically curated for me, but we can embed music throughout this entire continuum of acute care patients' stay, so that anywhere they go, they have the opportunity to decompress, focus on getting out of there and focusing on their health. So I think we have just begun to tap the surface of where we can integrate music in a patient's stay and follow them all the way through that experience. I would say don't be afraid. They're already afraid. So you be empowered to help them. Think of it as medicine. This music is medicine. This medicine for their soul and their spirit, and it's going to help them. So empower yourself to say, okay, it's okay for us to have a little music in here. nurses will anecdotally tell you, hey, I've gone into a patient's room, it's an end of life scenario, and the family brought in some music and it's very calming. We appreciate that too, because it's hectic for us. We have a hectic 12 hours typically. We're rushing around, we're doing all of these tasks. We're helping people who are hurting, we're helping people who are anxious, we're talking to family members who are anxious. So when I can go into a room and there's relaxing music play, I'm getting the benefit of it. I get that. So empower yourself to tap into that music because it is medicine. That would be my biggest encouragement for nursing staff. Thinking, hey, is this something I can do? You don't have to have an organized platform. It's great if you do, but I bet there's some music you can tap into that can help your patients. Appreciate you reaching out and giving me this opportunity. I enjoyed. We did the power of Christmas holiday music with some of our patient council many years. That was like 4 years ago now, or 3 years ago, which is crazy. And I just enjoyed that experience. So I knew we were going to have a good time, and this would be an easy conversation. So I'm glad you thought about me, and I hope this contributes to your library.